I'm a skin minimalist. I do not have a complicated skincare routine, and people are always surprised that I do get my skincare products at the drugstore. So again, my first tip to people is it can be simple, and it should be simple, and you don't need to spend a lot of money. I think that's a huge misconception. Now, there are people who really enjoy skincare, and they love products, and they love to try stuff. And if your skin is looking gorgeous and glowing, and you're happy with the results, by all means, keep doing what you're doing if you enjoy it. But I don't want people to feel like they've got to do this elaborate routine to have beautiful skin. You don't have to do that. So really the foundation for everyone's skincare, no matter what skin type you have.
Hi, everyone, and welcome back to the Her Guided Evolution podcast. Of course, I'm Dr. Shanice Jones Cameron, and I am here with a special guest, Dr. Mary Alice Mina. Dr. Mary Alice Mina is a Harvard-trained, double-board certified dermatologist, dermatologic surgeon, and leading expert on skin health and skincare. She is the host of The Skin Real, a podcast for people looking for real skincare guidance by true skin experts, where she emphasizes a holistic and preventative approach to skin health and aesthetics. With over 15 years of clinical experience, she is an invited speaker on podcasts and at national meetings. She is recognized for her artistic eye and surgical skills while helping people feel good in their skin. She is co-owner of Baucom and Mina Derm Surgery in Atlanta, Georgia, where she treats patients with advanced surgical and cosmetic procedures to restore and maintain healthy skin. So welcome, Dr. Mina. We're so excited to have you today.
Oh, thank you so much. I'm so thrilled to be here. I love your podcast, and I'm so grateful that we get to have this conversation today.
Yes, of course. Super exciting. So I just wanted to start out and just ask if you could just tell us a little bit about yourself and kind of your journey, and specifically what sparked your interest in dermatology. Did you always want to be a doctor and see yourself as a doctor? If you could just tell us a little bit about you and introduce us to your world.
Yeah, well, I'd love to. So if I ramble on, just cut me off. But yeah, so I actually have a more a non-traditional path into medicine. There are a lot of people who are doctors in my family, although I was the first woman, but so my dad was a physician, my granddad, uncles and all that, but medicine was never on my radar. I actually loved the arts growing up, and I was a ballet dancer, and I actually went and danced right out of high school, and I didn't, college or attending, like getting a non-dance degree really never occurred to me. I was going to dance, and no one could tell me otherwise until I was 21 and I got injured. And I sort of had to realize, what am I doing? And I realized I wasn't good enough to really, really make it at an amazing company and have this I wasn't going to be like Misty Copeland or someone amazing out there. And I realized, I got to see what else is out there. And that was the first time too, my identity was being a dancer. So it was very hard to wake up and realize I had to pivot at 21. I had to create a new identity for myself. But I knew I liked science, and I knew I wanted to help people. And so I gravitated towards, I was thinking physical therapy, and then ultimately decided to medical school. And I think as soon as I decided medical school, I was like, and I'm going to be a dermatologist, because I felt like I had seen dermatologists from struggling with acne as a teenager. And I thought, what a fun career to help someone with a skin condition. I loved that you could just look at it and diagnose it, and there's a lot of pattern recognition, and you have to have a lot of visual acuity to do dermatology. And I thought, oh, that's what I'm going to do. And I tried to like other specialties in medical school, because dermatology is very competitive, and I thought, I didn't, if I didn't have to jump through all those hoops, why do it? But I just kept coming back to it, and it's been a great decision. I've loved my career. I love my patients. I love what I do. And so that kind of brought me up to 2020. And then 2020, of course, everyone's world just turned upside down, right? And it was at that point where I started listening to a lot of podcasts. I had maybe a little more free time because patients weren't coming in, and we were scared and nervous. And I realized I love to teach, and I realized that actually speaking more broadly to the public being on social media, which I really had never been on before, other than Facebook, way back in the day, and speaking to the public with a podcast would be a way to get skincare information kind of to the masses, because it's hard to make an appointment with a dermatologist. With our insurance-based healthcare, they're very quick visits. They're rushed. It seems like I'm always running behind, and I felt like I wasn't able to give the information to my patients that I really wanted to. And so I've really enjoyed, for the last almost 2 years, having a podcast to help share just common sense skin information, but really not common sense if you're not a dermatologist or skin expert. And I felt like skincare has kind of become beauty care. And I think that leaves a lot of people out. I think it leaves people who aren't into aesthetics or kind of beauty and cosmetics out. And it also, a lot of men, I think, feel like, oh, well, skincare is not for me because I don't really care about that. And it can also frustrate people that, oh my gosh, like I've got to do all these complicated things. And so I think I am hopefully just giving information that actually skincare is whole body care, it's health care. And yes, there are aesthetic and beauty components that can be fun too, but it's more than just that.
As a health communication scholar, and just a scholar in general, we often get a lot of criticism in the academy as far as like, oh, you're in your ivory towers and you're kind of like disconnected from people and the realities of life. And so like I imagine from a medical standpoint, some of those criticisms in terms of like education and teaching may be probably prevalent as well. And I love what you said about like sharing information, particularly information that is that has veracity and can actually be verified and is coming from an expert. I think with us, when we have a lot of knowledge, that is really easy for us to kind of think like, oh, well, most people know this and everybody should know this. But really and truly, it's like these are the conversations that I think a lot of people need to hear, particularly surrounding like health literacy, and even just the brilliant connection that you just made as far as like skincare and beauty care and just kind of aligning with beauty. And as soon as you said that, I just immediately started thinking like, wow, that's really interesting. And like the ramifications of that, like kind of, I can definitely see that being kind of exclusionary, I would think.
Oh yeah, and you're so right. Like just because we think something's easy or, oh yeah, that's obvious, but it's really not. And I really learned that when I get kind of the same questions over and over, and I get questions from my patients or my friends or my family, and they'll say something like, just the other day, someone asked me, well, what does a squamous cell skin cancer actually look like? I've never even heard of that. And I was like, you've never heard of that? And we've been friends for how long? So, stuff that even I think, oh yeah, but people know about that, but they really don't. And I'll tell you, I'm in my mid-40s, and doctors being on social media back when I was training was really kind of taboo. It wasn't really encouraged, and we weren't supposed to do it, and you were kind of above that. And now this new generation of physicians I think are really adept. I mean, they grew up with social media, and that's where they consume information. But I think me and the older doctors, we have to learn, like, if we want to get information out to people, this is where people are getting it. They're getting it on podcasts. They're getting it on social media. And if we're not out there putting good information, there's going to be other people filling that void, and it's not necessarily the best information. And as we all know, right, it's so easy now to have a voice and amplify your voice, but it doesn't mean that that's really the best voice or that's the most accurate information. So I felt like if I'm not doing this, then someone else is, and it maybe isn't going to be great information.
Yes, for sure. And as my other hat, I'm a media and technology studies and health communication. Those are my areas of expertise. And of course, when you mentioned that a lot of times, or prior to, I guess, maybe this turn where it's becoming more acceptable for doctors to be using social media, I'm actually really, really glad and so happy that more doctors are doing social media and are taking this as an opportunity to educate the masses. Because being a media studies scholar, I actually contributed to a critical disinformation syllabus years ago. And misinformation, disinformation. I'll stay in the realm of disinformation because disinformation speaks to when information is spread and is intentionally deceptive, be it for profit or for political gain. And so I think about how folks use the internet and sharing information and being able to share misinformation and disinformation like instantaneously. And I've always thought that one small way, of course this can't eradicate all of the misinformation and disinformation, but I always would think that one of the ways that we can combat this is through more doctors and more experts having platforms and being able to speak directly to people versus this kind of idea of anyone who has a platform has like the credentials to speak on, like, I don't know, like anything medical, dermatology. I think that's a great thing. And so what is one book or research or treatment like related to dermatology that you wish that everyone knew about?
I think this whole term of disinformation is huge, and I'd never heard that term before until you mentioned it, but I love it, and it's so accurate. But what I wish people, I guess there's so much to know. I wish people would look at who's giving them information, whether it's skincare or not. Who's giving you the information? What are their credentials? And do they really have the knowledge, the education to back up what they're telling you? Or do they just have a big fan base or a lot of followers? And then the other thing would be, what's their angle, right? Because so many, especially in skincare, there seems to always be an angle. They're trying to sell you something. They're going to tell you X is bad because they want you to buy their product or whatever. So I just wish people would have a more skeptical view on who's giving them their information and look out if they're trying to market them something or sell them something, or if they're truly just giving them information, just make sure that they have the education to back it up. And then the other thing is that I treat a lot of skin cancers, and there's this like movement to say, Kristen Cavallari is saying like, don't wear sunscreen. Sunscreen's overrated. And I wish people could come spend a day in my office where I treat skin cancers all day. And the number one thing I hear my patients say, who tend to be like 60s, 70s, 80s, 90s, right? Nowadays, they'll tell me, I wish I had known about the damage from UV radiation from the sun. I wish I hadn't tanned. I wish we had sunscreen. They didn't really have sunscreen back then, or it was harder to find. And so when I hear people say like, oh, you don't need to wear sunscreen, or dermatologists, they're obsessed with sunscreen and it's going to kill you. I promise you, the sunscreen's not going to kill you. I do see skin cancers that kill people. I see the damaging effects, and it's not just melanomas, it's Merkel cells, it's squamous cells, and even basal cells typically aren't going to kill you, but they might take off your nose or destroy your face or whatever part of the body it's on. So I feel like people minimize that. And if there could be one takeaway, it is to wear sunscreen and sun protect. Sunscreen's not going to give you cancer. The studies that were done, they had rats eating copious amounts of it that no human being, I think you would have to slather your whole body every day for over 200 years to ever reach that level. So I just wish people would know that, because 20 years down the road, 40 years down the road, you can't really go back. And so that's part of the whole like prevention. And you can save yourself a lot of grief, a lot of heartache, a lot of visits to see someone like me if you can do something as simple as that. But and the other thing I'll just say too is it's sun protection is also more than sunscreen. So it includes wearing a hat, standing in the shade, wearing like a sun protective clothing. I'm a big fan of. And then the other point I'll say is sometimes people think sun protection or sunscreen is just for people who look like me. And sunscreen is for everyone, no matter what color you are. Everyone needs it. No one has skin dark enough that they do not need sunscreen. So that's another misconception I see people. They'll say, well, and I get this from my husband who's Egyptian. He'll say, I don't need sunscreen. I'm like, you do. So,
right.
Yes, it's for everyone.
Yes, I think that is something that needs to be emphasized, because I think there is a lot of, I'll say, miseducation about that. It has to be frustrating to kind of encounter I guess, misinformation and disinformation in this way, particularly when it's just something as simple and straightforward as prevention and skincare. So I imagine that just the internet, social media just adds a whole other like dynamic.
Yeah. Well, it can get frustrating, but then I'm also like, well, this is why I'm doing what I'm doing, right? I've got to just keep on and hopefully get this younger generation and younger people to be more proactive about it earlier. And I mean, skin cancers are the most common cancers in the world. They're more common than all basal, or I should say basal and squamous cell carcinomas. They're more common than all the other cancers in the world combined, and yet so many people don't even know about them. So that really boggles my mind. But as we're living longer and longer, we're going to be seeing more people over the age of 100 over the next several decades, right? I mean, our children may live to be 100, easily. So our lives are longer. We're here longer. We're getting better at treating conditions and chronic conditions. And so I think we're going to continue to see this rise in skin cancers unless we can be really smart about being in the sun. And I'm not trying, I go to the beach. I enjoy being outside. You can just do it, but just be smart about it.
Yes, and I especially appreciate your you describing like the different preventative measures that we can take, where it's not just sunscreen, it's also wearing a hat and standing in the shade. Because I never thought about that. I always thought like, okay, skin or protecting my skin is typically just going to be sunscreen, and I really hadn't thought about those other elements. So I particularly appreciate that, and I know that the listeners will get a lot from this conversation, but particularly those actionable steps that they can take to ensure the health of their skin. So one of the things that I'm curious about and would love to hear your expertise and your kind of explanation about kind of like the fundamentals of skin and skincare. Could you explain for the listeners what the different skin types are and what perhaps is like the best skincare routine for each skin type?
Yeah, so absolutely. So I actually have a PDF that people can get that I could share. It's at theskinreal.com/habit, and habits with an S in it can kind of help you walk through. But yeah, so I'm a skin minimalist. I do not have a complicated skincare routine, and people are always surprised that I do get my skincare products at the drugstore. So again, my first tip to people is it can be simple, and it should be simple, and you don't need to spend a lot of money. I think that's a huge misconception. Now, there are people who really enjoy skincare and they love products and they love to try stuff. And if your skin is looking gorgeous and glowing and you're happy with the results, by all means, keep doing what you're doing if you enjoy it. But I don't want people to feel like they've got to do this elaborate routine to have beautiful skin. You don't have to do that. So really the foundation for everyone's skincare, no matter what skin type you have, is to have a gentle cleanser, to have a moisturizer, and to have sunscreen. And so those are kind of like the three basics if you really, really, really want to keep it simple. Now, I guess I get a little fancy because I do add a few extra things in there. I really love a vitamin C serum. I think if you're probably over the age of about 35 plus, or if you have any we call it dyspigmentation, or your skin is a little splotchy, then vitamin C can be great addition in the morning. And then I am a firm believer in, this is another one that's getting a bad rap recently, I don't know why, tretinoin or retinoid or retinol. This is something that I've used consistently since really I had acne, and then maybe I took a little break in my 20s and then started consistently using it again in like my late 20s, my 30s. And that's a vitamin A derivative cream that you can use in the evening. So, I mean, that is my skincare routine. That is truly all I do. And so it really can be that simple, even if you throw in a couple extras like that. But I would say, so for the skin types that you asked me about, there are 5 skin types. first one would be normal skin, right? That's someone that isn't overly dry, isn't overly oily, doesn't particularly have sensitive skin. They can use a lot of products. They don't get irritation. The second one would be oily skin. And I've always tended to gravitate more towards the oily skin. That's going to be someone who's probably a little more acne prone. Your skin is a little shinier. I was thrilled when the glazed donut look came around because I thought, great. That's been me. I've been waiting for this. Oily skin, you are going to want to avoid things that are oil-based. You're going to want to avoid kind of thick, heavy products, things that are can clog your pores. So we say look for things that are non-comedogenic. For me, I don't need a heavy moisturizer. Typically, I will stick with more of a lotion, something more water-based that works well for oily skin. And then you've got people who have dry skin, and those people are like, their skin is so thirsty. They're always grabbing onto fluid. They can't put enough moisturizer on. Those are people who maybe struggle with eczema when they were younger as children too, and had more dry skin. And so those people, they need those more oil-based or those thick, heavy moisturizers, and they may need to moisturize throughout the day. They tend to not have problems with acne, but they have more of the eczema prone skin. And so, thicker things, more cream based, that's going to be more beneficial for someone with dry skin. And then people with sensitive skin, they tend to also have dry skin, but they really can't handle like any fragrances. For this group, like I don't usually do fragrances and stuff. I just like to keep it very simple, but I don't have sensitive skin, so I could use something with a fragrance, and typically it won't bother me. But people with sensitive skin, they are very prone to breakouts, allergic reactions to products. And so for those people, they really need to keep it simple, really basic, no fragrances, no scents whatsoever, because that can really trigger their skin. And then, of course, you've got combination skin. And those are the people that tend to be oily, more what we call the T-zone, over your eyes, down your nose, and then dry on the outside. So they've kind of have to toe the line between dry skin and oily skin. But those are kind of the main ones. And I'll give your listeners a quick tutorial on how you can figure out. I think most people sort of intuitively may know what kind of skin they have based on what they see in the mirror or what they feel. But if you don't know, you could do this quick. It's not complicated. What you want to do is wash your face with a gentle cleanser, and then don't put any moisturizer on. Don't do anything. Don't touch your skin for about an hour. And then after that hour, take a look in the mirror. You can take like a Kleenex, kind of blot your face and take a look. Are you oily? Is your whole face oily even though you didn't put anything on? Or are you just oily in the front? Is your skin feel tight? Is it flaking? Is it dry? And that'll give you an idea of where you fall. And then the other thing I would say is this isn't like your blood type, right? It's not like you were born with this skin type and it's never going to change. Your skin type can change, right? So I had oilier skin when I was younger, and now I'm more like combination. I'm getting a little more dry. I used to never have to use a moisturizer. Now I'm having to use one in the evenings. So your skin can change based on whatever stage of life you're in. If you might be pregnant, you might be menopausal or postmenopausal. So your skin type is allowed to change, and sometimes the seasons can make it vary too. So that's just kind of like a quick primer on skin types.
That is so helpful. In my mind, I thought there were just like 3 skin types. So to hear that there's 5, I'm like, I'm learning so much. As well as this idea of your skincare routine does not have to be complicated. So you said a gentle cleanser, moisturizer, and sunscreen are like the fundamentals and the necessities.
Those are the basics, and I will say, like for me, for people who have oily skin, your sunscreen oftentimes can be your moisturizer. Like that can provide some moisturizer. But it can be that simple and you can, still have amazing skin. I know people don't believe that, but you can. But if you want to get a little fancy, which I am a minimalist, but I want my skin to look as good as possible, and I want to, boost my collagen as much as possible and make it uniform. So I do the vitamin C in the morning and the tretinoin the retinoid in the evening, but I mean, that's it. So sometimes people will say, well, what about exfoliants, and what about toners, and what about peptides, and what about neck creams? And I don't use any of them. I find if you're using your retinoid pretty regularly, to me, that is exfoliating. At least for me, it does exfoliate my skin, so I don't really need anything extra. Now, if you're struggling with acne, you may want to do some other things, some peels, or some like a beta salicylic acid, a beta hydroxy peel could be helpful. Or if you're struggling with hyperpigmentation, you may want to do some other things as well. So what I'll tell people is you have to balance like what your skin needs and then also your goals. So if you're like, I don't care about anti-aging, I don't care what happens to my face, I'm gonna just like go with the flow, like you really can just do the cleanser, moisturizer, sunscreen. But if you're more like, well, I want to keep it simple, but I still want to look good, so you got to like pair it with what sort of your goals are too. And then if you are struggling with a skin condition like eczema or acne or scarring or pigmentation, then your skincare routine can change a little bit based on trying to treat those conditions. So our practice is procedurally, it's procedural dermatology. So I don't do general dermatology. Okay. I don't do psoriasis, inflammatory conditions, things like that. We tend to focus on, we do a lot of skin cancer. So a lot of my patients actually are older. They're out, I would say, 65 plus, right? But I'll say I see a lot, I'm seeing more and more people my age and younger getting skin cancer. So I also do that. Mm-hmm. And really just my interest in helping women in their 30s and 40s mostly stems from me being a woman who's recently been in her 30s and now 40s, and just trying to help people look good. I do cosmetic procedures, aesthetics, and things like that. But I also just want to spread the information or put the information out there that there's so many things you can do, but you don't necessarily need to do them, right? Like there's so many devices out there. There's so many at-home things you can do. And people will ask me, well, should I do this red light? Should I do this? I'm like, well, I don't do it. Like, what is your goal? Is there something you're trying to improve upon or treat? And if you don't need it, you don't do it. Like I don't get chemical peels because I don't need them. I don't get laser treatments on my face because I feel like I don't need them. But if you feel like you need it or there's something you want to improve upon, then by all means go see a dermatologist, talk to them about it. And so this kind of interest in helping is simply just because I am that woman and I know the frustration and the overwhelm, and I just want someone to kind of I wanted someone to sort of tell me, okay, this is what you need. You don't need that. This will help. And that it can really be simple. But my practice tends to be more procedurally related. So someone might come to see me for those treatments to help them with whatever concern they have.
So as we kind of think about like the different decades of life, I'm thinking 20s, 30s, 40s, what components, if any, should we be keeping in mind as we age and get into our 30s and 40s that may be different from like the skincare that a 21-year-old may be following, if there's any difference that you would say?
Yeah, well, so I don't know. I mean, maybe there are 20-year-olds out there who take better care of themselves than I did, but it was like my 20s was like a free-for-all. Like I was just trying to survive, and I definitely wasn't taking very good care of myself. But if you're listening and you're in your 20s, which I actually do think the kids today seem very interested in skincare, but they've done some studies showing that while they're kind of obsessed with skincare and products, that they still get sunburned. In fact, they get burned more than people who are older, and they don't fully understand they don't really worry about skin cancer down the road, and they're not really wearing sunscreen as often as they should. So if you're in your 20s, I would say like prevention is key, right? Like this is the time to really make those great habits and try to stick with them if you can. Wearing sunscreen, not going to tanning beds. I mean, I went to tanning beds in my 20s, and I'm like horrified that I did that. But no one's perfect, right? So even if
we learn and we grow,
exactly. So if you are in your 20s, I would say just like take. I would say who's giving you your information. Maybe take a step back if you're got a complicated routine, maybe focus less on the products and more on just overall good health, and that sun protection really is important. If you can start it in your teens and 20s, that'll make a big impact. Once you hit your 30s, I find a lot of women are, and they might be pregnant too in their 20s, right? But like this is when we're starting families, right? It seems like for a lot of women as we wait or delay having families. So in your 30s, you're pregnant. A lot of times you can't do a lot of the procedures, or you can't use your tretinoin. So sometimes I find women go one of two ways. Either your skin looks amazing and your hair looks amazing when you're pregnant, or it's like totally out of control. And it's difficult when it is out of control because we are limited in things we can do. But I would say definitely seek a dermatologist to help out if you are struggling. But I do find for a lot of women who especially have little kids too, it's like their health, their skin, all of that just goes out the window, right? Like you're just trying to survive. Yes. You're trying to sleep. But I would say for any of the moms of young children listening, I would say, take heart, spend the 15 minutes on yourself each day to wash your makeup off, to if you even wear makeup, right, to make sure you are still taking care of yourself. And I would say take care of your whole body health, really. Try to get as much sleep as you can, get help, ask for help. Know that you don't have to have this whole perfect life, this Instagram worthy family that we think we have to have. It doesn't exist. So I would say almost like focus less on your skin when you've got the little ones, and just focus on taking care of your general health, because that's going to make your skin glow too. Once you hit kind of 35, late 30s, I think that's when people start to notice some changes with their skin. They notice maybe some hollowing under their eyes, some skin laxity. And that's typically an age where I start to see people come in interested in procedures, interested in maybe, I'll say Botox, but like neuromodulators or fillers, stuff like that. But and if you are thinking about stuff, see a dermatologist and see what can be done. Because again, you're still in the sort of prevention phase and maintenance phase, and there's a lot we can do. Just little tweaks along the way so that you don't hit 55 and feel like, oh my gosh, like I've got so far to go. But that, I would say that's when really making sure you got a good solid skincare routine. Maybe start using that vitamin C serum in the morning. Start using consistently your retinol or retinoid in the evening. And if you're interested in doing some cosmetic procedures, those certainly can be done as well to help sort of stave off some of the changes you might be seeing. And then once you hit your 40s, things do change. You may find you have to modify your diet a little bit, that the things you used to eat and not gain weight or not feel bloated affect you differently. You may find that it's harder to get a good night's sleep, and your sleep's being affected, and maybe stress at work you're having trouble with. So I find that this is the area in general where women go through perimenopause and then menopause, sort of the end of their 40s into their 50s. And so I will say, if you notice things are changing, you're not going crazy, that they are, and that's totally normal. And to really, again, focus on your body. I think we spend so much time focusing on what product to put on, when really healthy skin starts from within. So I realized in my 40s I needed more protein. So I had been a vegetarian for 27 years. I started eating meat, making sure I'm getting enough water, that I'm sleeping. I really never prioritized my sleep up until the last probably year. And I've realized how important that is, not just for my skin health, my overall health. So, and then in the 40s, that's when I start to, if you are interested in cosmetic procedures, that I'll say, starting to do some biostimulants can help, maybe doing some microneedling, things like that to help boost collagen. If you still haven't gotten to menopause, I kind of like to think about collagen banking, where you try to boost your collagen as much as you can, because once menopause hits, you have this huge decline in your collagen, sometimes up to 30%. So I almost say, think of your 40s as like when you want a collagen bank and you want to you want to be like ready and prepared because it's coming, right? And it's nothing to be afraid of, but just know it's coming, be prepared for it, get your body in the best shape you can with diet and exercise, and boost your collagen as much as you can, so that decline is not as drastic when it happens.
I am so appreciative that you started making the connection between skincare and just kind of our overall health. I remember when I first started my PhD program in 2018, my twins were like 8 months old and my oldest was 3. And I just remember I was super stressed, and I'm not someone who tends to have a lot of breakouts. I had a little bit of acne in my teenage years, but breakouts would just come here and there. But I just remember at that time just having like these massive breakouts, and that just was really frustrating because I was someone who hadn't really had to navigate that a ton. So considering what you've mentioned as far as like the connection between like sleep and making sure we're drinking water, I imagine, could you speak to whether or not like stress can impact your skin, one, and two, what are some things other than like getting enough sleep and drinking water that we may keep in mind when it comes to like that connection between skincare and our holistic health?
Yeah, so I feel like this is a whole area that is just gonna like boom, and people, especially as we are living longer, and I think people are getting frustrated with the healthcare system we have today. It's very reactionary, right? You only go in when there's a problem. Insurance only will allow you to go in if there's a problem. I only get paid to treat a problem. I don't get paid to counsel someone on prevention and all that. So I think that it's great that people are looking elsewhere, right? They know like, I want to get this information, so I'm going to listen to podcasts like yours or mine to get that important information, right? Because prevention is so key, and we definitely have an epidemic of just a lot of chronic conditions, and a lot of them are related to increased inflammation. They're kind of related to this metabolic syndrome. So let's see, you were asking me like inflammation in the skin. I mean, this is inflammation in our whole body, we're now realizing, can cause so many problems. That's why you may notice like you have to adjust your diet when you're in your 40s or perimenopausal or menopausal, because you need more, you don't absorb things as well, and you need more fiber in your diet. I've noticed like eating sugar and drinking alcohol, I can't metabolize it like I used to, and I feel it, and it doesn't feel good. And sugar is a huge one, right? There's so much sugar in so much of what we eat, so much processed food stuff. Sometimes I'll say, well, I don't eat that much sugar, right? If I eat sugar, it's like a homemade thing or whatever. But if you actually look at like your ketchup bottle or all these different your salad dressing, like all these things have sugar that you don't even realize. Even when you think, oh, I'm not adding like white table sugar to stuff, but it's actually in so much of our food. And I'm not a dietitian and all, but I have just really become interested in my diet recently because I can't eat like I used to. I'm seeing the effects. I don't feel as good. I was gaining weight. And a lot of we've now realized like sugar plays a huge role, not just in our overall health, but it actually will bind to our collagen and form these things called advanced glycation end products, or AGEs. And so it binds to our collagen, and then our collagen becomes very brittle and stiff, and it loses the nice supple elasticity that it has. And so, it affects your skin like directly. Like, this is science. It's not just me saying don't eat sugar. Like, I mean, I have a sweet tooth too, but I do think about it now. Like, and I look at the back of things that I'm eating to see if there are some hidden sugars in there. Also, same thing with alcohol. Like, we're realizing it used to be, a glass of red wine at night is fine for women, 2 for men. But now actually we're realizing maybe that's not the case, that even just doing that can affect not only your body, but your skin. And studies have shown that your skin's more dehydrated. You have more fine lines and wrinkles. So if you are really trying to maximize, like making sure you're not excessively drinking alcohol, and maybe even cutting back to just 2 or 3 times a week can be helpful. Thinking about how much sugar you eat. eating more protein. So as we age, we lose our muscle mass. And so resistance training, which is something I never did before. I was all cardio, right? That actually is helpful, not just for our big muscles or how we look or keeping our weight down, but actually studies have shown that doing resistance training will actually improve the appearance of fine lines and wrinkles. And they've done some studies where they've measured the dermis, which is the part of our skin that has collagen, and they actually saw that was boosted, like that was thickened when in the people who did resistance training over just cardio. So if you need another reason to start incorporating weights and resistance training into your routine, here's that. Now, again, all of these, it's not like you can just do one of these things and you're going to have amazing skin, right? They kind of all work together, and your body will feel better. And when you feel better, you look better, right? But those are just some things to try. And I think we all know from anyone who's pulled an all-nighter or been up with a newborn, like when you don't have good sleep, you don't look good, right? Like you've got the hollowing under your eyes, the bloodshot eyes, the darkness under your eyes, like your body hasn't had time to recover, and your skin as well. In the evening, you've got less oxygen to the blood or to your skin. And so you see it. So helping with getting consistent sleep can help. And, I can't get 8 hours a night, but I can get consistently 6 to 7, which is a lot better. And for my body, that seems to work fine. So everyone's going to be a little different with that. But yeah, I think we're going to see a big push towards a more holistic approach to taking care of our bodies and our skin, and that it's not go buy this one cream and it's going to change your life. Like we really have to think of skincare as being from the inside out, and the benefits are huge, and you're not just going to have better skin, but your whole health is going to be better.
Oh, that is so helpful. And if we needed one more reason to cut back on sugar, I think this is particularly helpful. And I'm definitely someone who loves sugar. So, one more reason to kind of avoid it. I have to say, I don't fully avoid sugar, right? I think also life is meant to be enjoyed. And if you are so obsessed with counting things or what you can't do, what is the point of life, right? So again, I would say everything in moderation, but I am more cognizant about how much wine I have, and just limiting it to maybe the weekends. And I look at the ingredients on packaging of food and stuff like that. And it just gives me food for thought, right? I just think about it a little bit more. But it's not to say you don't enjoy your life and don't enjoy, things that bring you pleasure, because that's important too in life as well. Yeah, that makes a lot of sense. And I'm so excited to hear about the connection with strength training. I actually just started strength training within the last year or so. So I'm I guess I'm helping my skin inadvertently, even though I didn't realize it.
Yes, and those endorphins are going to make you look better too. So it's pretty cool.
Yeah, it reminds me of my mom always used to say when I was growing up, your skin is your largest organ. Be mindful of your skin and taking care of your skin. And so I think it's really helpful and important to make those connections between just kind of those, I guess, day-to-day choices, just being mindful of if you're strength training, that is something that can be beneficial, limiting alcohol, sugar. So I think those kind of actionable considerations related to skincare, I think is very helpful, and I'm sure a lot of listeners will be able to apply that. So I do want to be mindful of your time, because I know we're getting low on time. This has been so incredibly helpful and informative, but I did want to ask you, as a dermatologist, and you're doing all these cool things, you have a podcast, you're doing procedures and surgeries and all of these things, what does a day outside of work look like for you? And what are some of the things that you enjoy outside of like your career and your profession?
Yeah, well, this has been so much fun. I could talk forever about this. I do want to just mention two things that I do find I was thinking about for especially the 20-year-olds. Well, I didn't mention no smoking, right? I mean, I feel like we've gotten to the point in society, right, where we all know smoking's not good for you. And most young people are not smoking, but they're vaping. And so I would say if you're listening and you vape and you think it's a healthy alternative to smoking, you are not you are incorrect. And when you're in your 20s, you may not care about lung cancer, but you are going to affect your skin. And so I would just encourage anyone out there, like, don't think vaping's the safe alternative. It's going to wreak havoc on your skin as well, just like with nicotine from smoking. So the little plug for that, I have to include that. What does a day look like when I'm not at work? Well, first of all, like I feel like when you love what you do, it's not really work, right? It's fun. But yes, it is busy, and I do enjoy time where I'm not in the office. Let's see, spending time. I have two kids, they're 9 and 10, and I feel like it's a really fun age because we can travel now and they're fun to have conversations with. And we haven't quite hit the teen years yet, so they still want to be around us. So just hanging out with them, spending time with them and my husband. I love being outdoors, like taking walks and hikes. I think my favorite thing to do in the world is ride a bicycle. So if I can like hop on a bicycle and then go eat like a delicious meal, that to me is like the perfect date or evening. And that's a lot of fun. I love to do yoga. For me, that's kind of like my meditation, my quiet time, and I only do it about once a week just with scheduling, but I need that once a week like reset on Saturday morning. I really look forward to that. And I love to read. I really don't watch TV anymore. That's really something I've kind of stopped doing. But my kids like to do a movie night once a week, so we'll usually do that. But give me a book any day. I do love to read, and I love to be around people. I've found I think also with COVID, I realized, okay, I am an extrovert. I really do get energy from being around people. So I've got a great group of friends where we live that I can be real with, that I don't have to put up this facade that life is perfect, everything's perfect, and I can just be really real with these women. They tend to be women that, so I think just that spending time with them is really powerful for my soul as well. So yeah.
Yes, I love that, and I love to hear that even as a mom and a wife and dermatologist, even with all of that, it sounds like you incorporate self-care. I heard a little bit of social self-care in there, as well as like the physical self-care and mental with the yoga.
And I'll say it's not perfect, and really this is like I mean 5 years ago I was not doing this kind of stuff, right? Like I was not focused as much. I felt like I was in the throes of the toddlers and all that, right? So if you're listening and you're like, oh my gosh, like she's got it all together, she's perfect. Like, no, absolutely not. And this is, it's always fluid, right? Like there's some weeks I do better with self-care. I will say I need to get better and more consistent with exercise. Like I always say I'm going to do it after work, and then something always comes up. I've got to like put it in my calendar and commit to it. So that's kind of something I'm working on. Is focusing on that. But yeah, I mean, I think we're all just trying to do the best we can, right? And we wear a lot of hats, we're juggling a lot of things, but so is everyone. And it's not always perfect, but just keep trying.
Yeah, something that I emphasize all the time is that this is your life. This is your life. This is your life to live. This is your one life to live. And you deserve more than just working and taking care of other people. And I think self-care is one of those components and one of those aspects where if we invest in it more, I think it's the key to building our relationship with ourselves. So I really appreciate you just kind of giving us some insight into what your life looks like outside of dermatology, as well as a little glimpse into your self-care routine as well. So, Dr. Mina, this has been fantastic. I've really enjoyed our conversation. Can you tell the audience where they can find you and all your socials?
Yeah, well, this has been an absolute delight. I loved our chat. I feel like we could talk forever. But yes, I will. If people want to listen to my podcast or see what I'm up to, I'm at Dr. Mina Skin on all the social media platforms. And my podcast is The Skin Real. That's REAL, not REEL. And yeah, check that out if you're curious about like real skincare that's unhyped, unsponsored, and just good information. Check that out. And then if you're interested in the how to create healthy skin habits, like I mentioned earlier, it's theskinreal.com/habits. And you can sign up and I'll send you that.
Perfect. Yes. And if you're listening to the audio version of the podcast, of course, I will put Dr. Mina's information in the show notes. If you're listening on YouTube, just check the description box and all of her information will be there as well. So thank you so much, Dr. Mina. This has been fantastic. I appreciate you taking some time to hang out with us on the Her Guided Evolution podcast.
Thank you so much. Keep doing amazing work.
Thank you so much.